are suddenly recovered and able to fight crime again, then true CPR can take up to 10 minutes until EMS has arrived. CPR is extremely messy. Sometimes a patient can regurgitate that you don't want to see. Sometimes the patient is choking on something that you really don't want to see, but you have to anyway. You know, you want to save a lot. Okay, babies. Okay. For babies, they're really delicate. So instead of doing the full hand on top of hand, you want to use your pointer and your middle finger and go between the chest, like in the diagram, and press down lightly. Also, whenever you're giving a baby rescue breath, you don't want to do a full breath. You want to do a puff. So, because if you do a full breath on a baby, their lungs will probably can't withstand the pressure, and it'll make the situation worse. I think the baby goes to the hospital even faster. For a child, they're from 1 to 8 years old. You can do a little more pressure because they're not as delicate as a baby, and you do 30 palpations with your hand and your interlaced fingers, and you give 2 full rescue breaths, and you hold it out, and you're also staying alive. So, if help is not found in 4 to 6 minutes, the child will sustain permanent brain damage because blood flow stops, and you need to repeat until the victim has revived or EMS has arrived. For an adult, if you suspect the victim has sustained spinal or neck injury, do not move or shake him. Otherwise, shake the victim gently and shout, "Are you okay?" to see if there's any response. If the victim is someone you know, call out his name as you shake him. You do the same thing, but you can add a little bit more pressure. You want to go 1.5 to 2 inches into the chest whenever you're doing your palpations. You do 2 rescue breaths, and you definitely need to sound it out. You need to tilt the head back, pinch the nose, and tuck the chin, or hold the chin to make sure it's an effective CPR session.